Welcome to Mental Healthy, the podcast where we share stories of the professionals and experts worldwide working in the mental health field. Here's your host, Dr. Kenyon Knapp.
Well, welcome everyone to the Mental Healthy podcast. I'm glad to have you with us here today. And I've got a special guest, Dr. Patti Hinkley. Welcome to the program, Dr. Hinkley.
Well, thank you for having me. It's a pleasure to be here.
Well, I appreciate you being here. And now I know you a little bit since we worked together here at Liberty, but the guest, the listeners may not really know you. Could you share a little bit about yourself and maybe your background?
Sure. I'd be happy to. Well, currently I'm working as a core faculty member in the clinical mental health counseling program at Liberty University. I also am living in Florida, so I'm working at a distance, and I have been for the last 19 years. A little bit about my backstory is that I grew up on corn and soybean farm in Iowa, and then came to Liberty as a freshman back in 1980s. So I'm dating myself here. That was many years ago. I graduated with both my bachelor's degree in psychology and my master's degree in counseling at Liberty. And then right at that time, LU started their distance learning program, which was called Liberty University School of Lifelong Learning. And I started out as an academic advisor. And then throughout the past 39 years, I have been in many different administrative roles, along with teaching 38 of those years. And in the last 7 years, I moved out of administration and basically into just teaching full time, which I'm absolutely loving that. I enjoyed administrative work, but I'm enjoying just investing in students at this point. At that time, throughout that time, I also earned my doctoral degree and received my license in professional counseling as well as marriage and family therapy. And when I was up at Liberty University, I counseled part-time at a local Christian counseling center. At that time, it was called Light Associates. I think it's called Light Counseling now. And I worked there for 19 years before I met my husband, who lives here in Florida. So that's what brought me to Florida. And I'm now just working for Liberty and doing some part-time counseling out of our church, just really lay counseling at this time. But I've been with Liberty for 44 years and I'm still loving it.
Oh, that's great. Well, and with all those years of experience, you've got a rich background to speak from today, which I always like that when our guests come in and they're not wet behind the ears, I guess you could say. So I know today your topic is about intimate betrayal trauma. I've heard that phrase before, but I know it's a new term or a newer term. Could you explain that a little bit about what does intimate betrayal trauma mean and what does it look like a little bit?
Sure. Well, the simplest way to describe it, or as I describe it anyway, is an individual's trauma response to a partner's act of sexual infidelity. However, sexual betrayal can be conceptualized in many different ways for different people, like when a spouse is involved in even pornography, cyber sex, strip clubs, prostitutes, even emotional affairs. The betrayal can come across as trauma to the partner. And one of the key aspects is that it takes place in the context of a committed relationship where there is an expectation of honesty and safety. So typically that's marriage or other strong romantic relationships. So therefore, it is one of the most intimate type of betrayals that one can experience. And in some of the studies that I've seen, it's estimated that about 20% of married women in the U.S. have been betrayed by partners who have had sexual affairs. So that's a large part of the population.
Wow. I knew it was some kind of percentage, but 20% sounds pretty rough.
Yeah, it does.
Goodness. And I know the word traumatic or trauma is part of the title of this dynamic that you see in your clients. Could you describe the traumatic part of it? Like, what does it look like when you see that trauma in your clients?
Sure. Well, some in the trauma field find it very difficult to identify betrayal as traumatic. But when the symptoms are actually explored of each of these ladies who are coming in, and I'll back up here a moment just to say that my research has really been focused, because I counsel women, on counseling women who have been betrayed. So I'm guessing that a lot of these same symptoms may be the same for males, because obviously they also get betrayed by women. It's just that a lot of the research out there has been really focused on the women, at least at this point in time. But anyway, like traumatic events, it's a situation that takes place that's really outside of the control of the wounded individual. And so it overwhelms the nervous system, and it catches them off guard, and they don't feel prepared for how to handle it. And they're feeling helpless. And so the typical initial response is acute trauma, or just like shock. They can't believe it's happening. And then it becomes even more severe when there are repeated betrayals over an extended period of time, which typically does happen. And so there's a difference between like a one-time disclosure of sexual infidelity, and that be it, and then having this repeated betrayals over and over again. And that's usually where you will see the clients or these women develop symptoms similar to PTSD. In one of the studies I read about, that they even said that the peak time for experiencing PTSD and depression was between 6 to 12 months following the discovery of the betrayal. There's a lot of different trauma symptoms that will come out of that as well. So I can go into some of them if you would like to, like, for example, reliving the events or having flashbacks. Most women have a difficult time like getting the image of their husband's infidelity out of their mind. So they end up replaying it over and over again in their head. And this is essentially because their brain gets stuck trying to make sense of the betrayal. You know, on the one hand, they want to reconcile the behavior in their minds, but on the other hand, given their version of the reality and the evidence that they see, they just can't do it. So it kind of leads into this term that we call reality fragmentation, which occurs when a woman discovers that the reality she thought she was living really isn't real at all. So that is one symptom. Another is avoidance. And I guess maybe these are more reactions. It's typical for her to want to avoid places, things that remind her of the betrayal. This can be like going to church and seeing happy couples, or it can be even watching certain movies or TV shows that have a theme of infidelity. I had one of my clients who would say, you know, I have to take a long way to go to work just because I can't stand to go by the hotel. I have an emotional response. I get triggered whenever I go by a hotel where I knew that a sexual betrayal took place. And so it's really hard. And part of that avoidance, too, is the shame that comes with it, because we haven't really talked about this part of it, but a lot of times the betrayal comes out of a spouse that may be sexually addicted. And there's just a stigma about that for the couple. And so it can cause the woman just to withdraw and avoid being around other people. One study found that 92% of women who are sexually betrayed feel shame, which is just what we're talking about here, even despite the fact that their partners were the ones that engaged in the behavior. So it just makes it difficult to trust other people. They become skeptical of everyone and who they can trust. Hypervigilance is another one. So these are all trauma symptoms. So when you look up trauma in the DSM, the diagnostic criteria for actually diagnosing disorders, these all fit right into that. So hypervigilance, the betrayed woman often becomes hypersensitive to any indication that her partner may still be acting out. So you can imagine when you repeatedly find out over and over again that a spouse, you know, has betrayed you, you get to the place where you're permanently on edge. So that's often what they report, and where they're scanning the environment all the time, checking behaviors, maybe checking the phone, the computer, anything at all that might indicate that there is another trauma that's coming, you know, for them. And because there may be, you know, more and more infidelity taking place. And I guess it's their way of really trying to control the situation, even though it doesn't work that way.
I guess that could even become an obsessive thing that controls the lady in that situation, like where if she's checking the computer all the time, the phone, the whatever, she can, you know, not focus on other parts of health, healthy parts of her life, and she might just obsess over this might happen or this might happen. I have to catch it or something, instead of like not wanting to be tricked again per se or something like that.
Yeah, I think it really is, because it's her way of trying to protect herself from being so caught off guard. Usually that first discovery it just causes so much, like a whirlwind that I often hear them describe a whirlwind of emotions. They have shock and anger and rage and fear, and they feel shame and unloved and rejected. And it's just, it just whirls around them where they just feel like they're a mess, and they're angry, yet they're depressed. They're trying to forgive, and yet fearful that it's going to happen again. And I think part of what happened too that makes it so hard for them is the gaslighting that takes place, where there's this repeated deceit, which often they will say is even more harmful to them than the actual infidelity itself. Some of you may not be aware of what gaslighting is, so I can share just a little bit about that.
Please do, yeah.
Okay. It basically occurs when a woman confronts the betraying partner and is continually lied to. And then the behavior is minimized as he tries to make her believe that she is part of that problem, or it's all in her head. So, for example, she finds a receipt to a hotel in his pants pocket, and she brings it out and confronts him with it. And he's like, "Oh, that's just crazy. I used that the other day." And he comes up with his own excuse. And then he tells her that she's paranoid and it's all in her head. And as this is repeated and repeated, then it's just really hard, because she begins to start feeling like she's the one going crazy. So there was a study done by Kiefer and Skinner, and what they found is 2/3 of the women said that the deception and the lying was more damaging to them than the actual sexual behavior, which I had mentioned, where the infidelity becomes secondary to actually the deceit that takes place, because it just catches them off guard.
I'll mention to the listeners, I used to work with this topic a little bit as well in my private practice years ago, and still a little bit today. But, it reminds me, so many of the dynamics you're describing are really classic, trauma, crisis and trauma dynamics, but of course applied to sexual betrayal. Like earlier when you were talking about the repeated betrayals, in all the literature, we call that complex trauma. And of course, the hard part about all this is, whenever you're dealing with an addiction, whether it's sexual addiction or some other type of addiction, the chance of the betraying spouse doing something again is pretty high. I mean, like, they may not want to, but if there's an addiction per se going on, the chance of some type of relapse or something is fairly high. And I guess that raises the issue for your clients of, once they've been betrayed, how do they ever decide to trust again, versus protecting themselves and never trusting again?
Yeah, and I think that's one of the hardest parts to it, because trust is such a big part of it. Here you have a person that you've committed in marriage. You've committed your life to this individual, and you basically they're that attachment figure, to where you feel safe with them. They're the person you come to as a trusted confidant. And all of a sudden, when the betrayal takes place, all that goes away. And all of a sudden they feel like they're married to a stranger, that their whole reality just fell apart, and they don't feel safe with them anymore. And so that really is very hard for them to really to wrap their head around. And then that really causes a lot of these traumatic trauma symptoms to come from that. We talked about psychological and emotional consequences, but there's also physical. They have eating disturbances, greater risks of illnesses, financial. They can get surprised at how money has been spent, and they can't believe that this deceit has taken place like this. The sexual, intimacy, they may even have an aversion to sex now. And even spiritually, they have a hard time, because they're questioning God, and God's sovereignty and how He allowed this to happen. And then they have conflict over maybe their anger and fear, and even the need that they feel like they need to forgive. So it's just this whole, and it all revolves around that trust issue where they just don't know what to do with it. It's very hard. And a lot of times they will isolate themselves, pull themselves away from other people. And that's a dangerous thing to do, because a lot of shame comes from isolation. You start ruminating on things, and it gets worse than, it already is worse. It can even get worse as you continue to ruminate on it.
Yeah. A lot of bad things grow in secrecy.
Absolutely.
Shame, whether it's the victim or the perpetrator who's one being secret. You used a phrase a minute ago about attachment, and I know there's attachment theory. Could you talk about that for a second, about like what are some of the negative attachment issues that go along with this kind of betrayal?
Well, basically there's a sacred bond that takes place in physical intimacy anyway, and that's broken, which then that really is a huge attachment injury. And basically what happens to people, even as a child in the attachment theory, is they have this secure person. It's the primary caretaker, usually, that they have learned to attach to and realize that person's going to tend to their needs. And this baby learns to trust that this caretaker is going to be for them. And so a lot of times that's carried on, and we could all get into attachment theory because there's a lot of different types of attachment that where secure attachment doesn't take place. But then all of that is usually carried on into relationships. So if we have a securely attached person, what happens is typically they will attach then to their spouse when they get married to them, and they become that trusted confidant. And so when they break that covenant, that safety, and they realize they're not safe anymore, then that's considered basically an attachment rupture or injury, where the woman no longer feels safe. And that is a big part, I think, especially in clinicians as we work with them in therapy, is really trying to help them to work through that and to get back to a place of safety in their life, because that's just kind of just blown apart, and it really rocks their world for a while.
That makes perfect sense. I totally get that. Well, since you work with a lot of ladies that deal with this, what are some of the challenges that women face when they seek help for this?
Sure. I think one of the biggest challenges that I've heard is that a lot of times they will go to a counselor who counsels from an addiction model. And so basically what that does is focuses the therapy really on the husband's addiction and how to help him and how she should be working with him to overcome it. They focus on helping the woman to forgive, to look at the part maybe that she played in the breakdown of the relationship, and then even helping her to forgive, and just kind of move on and just move forward. And how, and this comes back to, however, in the last decade, these women have been more and more recognized as trauma victims, because when they are actually counseled from an addictions model, it really almost puts some blame back on them that can be very psychologically damaging to her. And it can almost re-traumatize the woman. That's what a lot of the women will say. I went to this counselor, and then I came out feeling like it's all about me again. And I already feel like that because that's what my husband's telling me through the gaslighting. And so it doesn't help her. In other words, she has her own symptoms that need to be cared for and needs to heal from. And a lot of times the attention goes off of that to more focus on the addiction. So the trauma model is a model that is becoming more and more well known, which really is I personally think is the best way to approach it, just because there's so much proof that the symptoms that they're experiencing is PTSD and has a lot of the symptoms of PTSD.
Yeah, that makes sense. I know what you're talking about. Like sometimes with the addiction model, they'll almost diagnose the lady's reaction symptoms to it, and they'll sometimes use the phrase like she's a co-addict or things like that. I can certainly see how that can be almost re-traumatizing. Like when you come to the therapist and they and the hypervigilance and the way she might obsess about his addiction may not be a healthy way of reacting, but it's a logical way of reacting. And
exactly.
So if they start like diagnosing her logical reaction, it does feel like blaming for her, definitely. That makes sense. Well, let me ask you. Let's get practical here. You're in private practice. You've been working with this type of issue, and some lady comes in and she's been sexually betrayed. Where do you start the treatment with her? Like, where do you even begin? It feels like this whole thing is such a big mess. Where do you start?
Yeah, it is definitely a mess. It is definitely a mess. And, and I'll come back to the addictions part of it too, before I start into this, is that there is a place, to get to that, at a place in therapy that you will probably get there. But at the very beginning, it's really important to bring stability and stabilization to the woman with what she's going through, all of this mess that you're talking about. And so there's a trauma-informed model that I like to follow, which one of our she's retired now, but one of our former professor, Dr. Barbara Steffens, and then her colleague, Janice Cottle, have come up with this model and its approach. It's got 3 phases to it. So it's safety and stabilization, and then moving into remembrance and mourning, which is really more where the therapy type work takes place as they grieve. And then it comes back to reconnection. And so, basically, you have a woman that's coming in, she's in shock. Sometimes she's in denial. Those are the first responses, maybe numb. And basically part of that is helping them to stabilize and to feel safe again. So one of those is, I always like to think of it as knowledge is power. So helping to educate them on what is happening and that they're having this response. It's a normal response to normalize it for them, to help them to understand that these are trauma responses. And this is typical. It's normal for someone who's experienced a trauma to be reacting and feeling this way. And that can really help them to know what to expect and to kind of calm down with that anxiety where they think they are going crazy. Also, there's a place to also educate them about sexual addiction, which is a huge part of the problem probably for the spouse. So to know what to expect with that may be helpful there. Another reason why psychoeducation is especially important is because it empowers the woman at the time when her life feels completely out of control. So to give her some tools that help her to understand what's happening, and then maybe some tips of how to move forward. So there's a lot of different forms of education in books, seminars, support groups, online communities that she can get involved in.
Sure. I know there's some listeners right now who are hearing everything you're saying. They're going, oh, yeah, this is great, or I've got a client with this, or whatever. What are some books or resources you might recommend to help the person at this point?
Sure. There's a couple that I would highly recommend. One is Your Sexually Addicted Spouse and How Partners Can Cope and Heal. So that's basically, a book that's all about how to work through the healing process, how to cope with it. It's by Barbara Steffens and Means. And then there's another book by Sherry Kiefer, Intimate Deception, Healing the Wounds of Sexual Behavior or Sexual Betrayal. So I think both of those can be very helpful for someone who is going through it and trying to understand their own symptoms, and also hearing about experiences. I think it's always helpful for ladies to hear the encouragement of people who have gone before them and what were helpful tips for them. And they do include all of that in their books. So
question two, a lot of our listeners are interested in a faith-based approach to things. Are these 2 books you mentioned, do they come from a Christian integrationist perspective, or? They
definitely are. And they're faith-based. Okay. Both of them are.
Okay. Well, great. I cut you off. I'm sorry. I just had to ask about the resources, but you were talking about the treatment approach and the trauma-informed model. What are some of those steps involved? Yeah.
Yeah, so some of the other steps, I'll just hit on a couple other items, probably in that first layer of getting stabilization and security and safety for the woman. So the other part to that, other than just the education and helping them to get in touch with some of these tools that might be helpful, would be also learning how to establish healthy boundaries. So we call it boundary work. So there's lots of different boundaries that need to really be evaluated. Physical boundaries, like what's going to happen now? Where are you going to live? Is there going to be a temporary separation that might be best here? Or maybe you'll sleep in a different room? How much will you see each other? Where would the computer, if computer was involved in the betrayal aspect, where is that going to reside in the home? There can be emotional boundaries as to when and where the couple will talk about their issues. If they're together in the home, it can turn into constant conflict all the time. And so it's important for both of them really to set up boundaries of when they're going to talk about it, and then limit, the discussions that take place at home, because a lot of times at this place, it's really good to have those discussions in front of a counselor, if possible, to help work through that. And then there may be sexual boundaries, whether to refrain from sex for a period of time. These are all things really to work out with each individual. Each couple will be a little bit different as to what might be best in helping them to heal and to work through it. So I always look at it as boundaries can help a woman show that she cares about her own emotional health, to look at what her needs are, and that she needs to look out for her healing, at least initially first, before they can really move into working on the relationship issues. And so self-care and coping skills are a part of that too. I like to tell women, that they're not responsible for the betrayal that took place to them. However, they are responsible for how they take care of themselves and moving forward, and try to get them moving in a forward-thinking fashion, and coming up with ways to help themselves. So that's that first stage. The second is then, once they're kind of stabilized and have that sense of safety, boundaries set in place, it makes them feel like they have a little bit more control. Then to move into the remembrance and mourning phase, which is that second phase. And basically, there's just so many huge losses that take place. So there's a lot of grieving. And I think, the biggest loss is that her perceived reality is very different than what she thought it was. She's not living the life that she thought she was living. When a woman experiences sexual betrayal, she has to grieve the loss of what she thought the relationship was, in addition to who she thought her partner was. And then often her own identity was wrapped up in her role as a wife and a partner. So she can also lose her sense of herself as well. And so, some people have said that it's like the death of a little girl's happily ever after. The dreams of being in love and being loved by someone who is faithful and committed to her is just dissolved in front of her eyes, and it can be very, very hard to deal with. And part of that too, when you're getting into that mourning, the grieving part, is also dealing with their cognitions and the beliefs, especially if gaslighting, which is usually involved, the deceit. She's already has these beliefs: I'm not good enough, I'm not sexy enough, otherwise he wouldn't have had an affair, I'm unlovable, I can't trust anyone. And so helping her to work through those is really important. And I always look at it as, replace them with truthful and positive thoughts about herself, and I take them back, if they're Christians and they're into faith-based counseling, is what does the Bible say about them, and have them lean into that to realize that I need to replace these thoughts that I have with the truth of what God says that I am before him. And another part of that too can be group support. As she's going through the mourning and working through these cognitions, getting into a group with other women who have gone through the same thing can be very helpful, so that she doesn't feel like she's alone in this. So, and then the third is the reconnecting tasks and re-engaging. And this is really the last phase, which is creating a new vision for the future, engaging in positive life activities, or even resilience building activities are important here. Forgiveness can play a role here. And of course, it's always good to forgive when you've been offended by someone. However, I will just say here that often, many times these women are very quick in their head to say they forgive, and then they just want to move on and just forget about it, and that in that case, what that really does is it actually buries the pain and that really needs to be worked through. So I usually tell women, there are some things that happen to us in life that are really hard for us to forgive as humans, and it really takes the supernatural work of God working through us to bring us to that place where we can process through it, and that just takes time.
Yeah. I forget which author it is that uses the phrase spiritual bypass when especially for Christian women, if they say they forgive and then they sort of don't really process and validate and really be heard for the trauma they went through, and that we can sometimes unintentionally sort of skip past part of the therapy process. I could see how that could happen. That makes a lot of sense. At the same time, I can see, and based on some clients I've worked with in the past, you definitely want to give the victim a chance to, share the trauma, to really get it all out and to validate their feelings, and when they share all these thoughts where they feel like they're going crazy to think that, to really validate that they're sane. That,
right.
When they feel like they're losing their mind, when they feel this level of betrayal, they're really not losing their mind. That they're hurt, and that's valid and real. But there's this hard balance of like sort of staying there long enough for them to feel validated and heard. But that at the same time, as Christians, we always have hope that even if the fairy tale that they had for their marriage is not there, that God can write a new chapter in their life that can be really, really good too. So how do you sort of balance that in the therapy you do with women, like a sort of staying there long enough, but keeping the hope there?
Yeah, and I think each lady is a little bit different, and so it's always important just to kind of see what the need of the client is at the time. So some people, it takes them a little bit longer to work through just expressing and getting out just their feelings and just tell you about all the symptoms that they're having and why they're having them, and the anger and all of that goes with it is very therapeutic. But then you're right, there comes a place where it's time to move past that, because you can get stuck there. And then you can ruminate on it, which then that's no longer productive. And I think that's where we just have to be very careful to kind of assess what's going on. Is there a downward spiral taking place in the way that she's thinking, and it's taking her down deeper into a depression? And if that's happening, then I think that's something to talk about in therapy, and to then say, okay, I think, this is good, and we can still talk about these things, but we need to start moving forward too. And can we start talking about what we can do and setting up maybe some goals and moving forward? And I always like to bring in, biblical encouragement if they're a Christian, because of the fact that God lets us know his heart is for those who've been deeply wounded. I mean, it's all throughout the Bible. And so helping her to see that her identity really needs to focus on what God says about her in his word, and that she's deeply loved and cared for. I always think of Isaiah 43, 2-3, where it says, when you pass through the waters, I will be with you. And when you pass through the rivers, they will not sweep over you. When you walk through the fire, you will not be burned, and the flames will not set you ablaze. For I am the Lord, your God, the Holy One of Israel, your Savior. And so I think, there's several verses like that talk about God's close to the brokenhearted and saves those who are crushed in spirit. And, I think it's so important to really do an assessment of where a betrayed person is in how they see God in their life. And do they see him as strength for them or not? And maybe then that's something too that becomes part of therapy, because a lot of times people just shut down. God doesn't love me, and they just jump to these conclusions. And so helping them back through that, and I think, it takes a step at a time. Faith builds over time. And so as they reach out and they trust God and they see that he's faithful, then it helps them to move forward. And I can tell you many times where I've had clients who many years later have come back and said, I had a horrible time going through this, but I can't tell you how much I learned from it as I leaned into God. I found out more about myself, about what I like, what I don't like. I found God is faithful, and now they're thriving. And so I love it when I see that, because there's that choice to let what has happened cause a person to become embittered and just isolate and pull away from God and pull away from life and really engaging in life the way that they could. Or it can be a person who learns from it, leans into God, and God gives them strength and directs their path, and they start to thrive.
If that makes sense. It reminds me of Job. I think it was Job chapter 42, where Job says, I've talked about you, God. I've said all this stuff, but now my eyes have seen you, because all that I've been through, all the hard times, that there is that deepening spiritually that happens to people who are open to it, who are open to drawing closer to God through their pain. You mentioned some great books before, but if there's people listening right now and they go, hey, I feel called to work with this topic, or I've already got clients with this issue, are there other resources or other books or anything else you would recommend to help people with this topic?
Sure. If there's, one organization that I would recommend is the Association of Partners of Sex Addicts Trauma Specialists. It's apsats.org. And they actually offer a certification that can train counselors in dealing with intimate betrayal trauma. So that's one of the things that I usually encourage. If somebody asks me, I want to go see a counselor, do you have a recommendation? I encourage them, if they're not in my area and I don't know of anyone personally, I send them to this website to actually look, because they can look up their location and see if there are any trained in their area. And that's one resource. There's lots of organizations out there, 12-step organizations that you can get involved in. Codependence of Sex Addicts, COSA, COSA is one. Codependence of Sex and Love Addicts Anonymous. So there's a lot of those if you go online and I actually think on this site they also give a lot of those too, as well as books. They have research articles on there that can be helpful for whether it is somebody that has struggled with it or it's a clinician that wants to be trained and learn more about it.
I know from my experience in the past, some of these groups are pretty hardcore in the addiction model that you talked about earlier.
Right.
And then some of them have a little more of a trauma model, like you were talking about. So,
right.
And some of these groups out there that are really common, like SAA, Sex Addicts Anonymous, or Sex and Love Addicts Anonymous, these are secular groups that may or may not have a Christian approach to the topic. And I know there's probably the most well-known Christian 12-step group is Celebrate Recovery, but there are groups across the country. They may or may not have a sexuality subgroup in their local ministry. So I guess what I'm hearing you say is Association of Partners of Sex Addicts Trauma Specialists. Is that the number one group you would probably recommend, or is there another one?
Yes, that really is one that I highly recommend. And I've had even some of my students have gone and taken training there, and they've just found it outstanding. Again, it was started by one of our former Liberty professors, Barbara Steffens. It has a lot of good resources, and that is probably where I would have people start. As far as those other organizations, I always encourage people to seek out a counselor who has a background in it, if they have training in it, or at least, has been trained in trauma counseling, and then work with that counselor to decide what additional things might be most effective for this particular person. Whether there's sometimes groups and churches that they'll pull together, led by a counselor, that can be very helpful. I think, any connection that ladies can have with other people who have gone through the same thing can be very valuable, especially if it has the guidance of a counselor who's kind of watching out for the benefit of everybody involved.
Well, this is great. I mean, you've covered a lot of ground. I know I may have not have asked you the right question at some point in the process. Is there any, final thoughts or summary ideas that you wanted to share today that I haven't asked you about?
Well, you've done a really good job of asking great questions, but I would just say, like I mentioned, if somebody is in the midst of this, my heart just goes out to you, first of all. And I really encourage you to seek counseling. So many women try to deal with this on their own, and they're afraid, they're ashamed, that shame comes out. And I just really encourage you to seek the help or the counseling. At a minimum, have a trusted friend in which you can express your emotions to. But of course, getting a counselor who's trained in intimate betrayal trauma would be the best thing, I would believe, to be helpful for you. And then, and just like I mentioned earlier, the second recommendation is just to lean into God for comfort, for wisdom, and not allow yourself to just get so busy. We're all like that. When we're hurting, we don't like the pain. And so therefore, we want to get busy and distract ourselves from it. And like I said earlier, that can actually slow down that healing process and distract from the healing. So I encourage you to make sure that you have margin in your life, to spend time with God and to just journal and ask God, what is it that you want me to learn from this? Help me to heal. And that can there's just a lot of tremendous things that can come out of that. And like I mentioned, I've had several clients who've come back and they're thriving when they've taken that kind of an approach.
That sounds great. Well, let me ask you too. I know there's some counselors and psychologists listening to us as well. Do you ever do consulting work or any trainings on this yourself, or would you prefer just to refer the people to those organizations you've mentioned?
Well, I would certainly be happy to talk to anybody that might want to talk to me about this. I specifically, I have done some presentations, but not necessarily training on this. But I have done a lot of counseling with this.
Is there an email address you'd
yeah, sure. Well? It's P. Hinkley, PHINKLEY @liberty.edu. Okay,
great. Well, I think that'll probably help somebody today who's really, needing some guidance and advice from, someone like you who's done it longer and know how to help people who are going through this. Sometimes I'll sort of wrap up with a little outgoing promotion of the podcast here, but I sort of feel led today. Could you maybe close us in prayer for the counselors and clients out there right now who are really struggling with this kind of issue? And we'll maybe sort of wrap up that way today.
Sure, absolutely. I'd be happy to. Dear Heavenly Father, God, we just come before you. God, I lift up, the ladies or even the individuals out there. It could be men too who have been betrayed, that are listening to this podcast and are deeply hurting at this point in time. God, I pray that you would just show them the way that you want them to go. God, lead them to the right counselor, the right tools, the right books. Father, I pray that you would help each one of them to just sense the comfort and the love that you want to give to them. And Father, we pray that you would just instill hope, especially hope that there is hope for a future beyond this. In the middle of it, it's hard to understand. And God, we know that we know that you know that, and we know that your heart is for those who are wounded. And I pray, Father, that you would just reach down, meet the needs that are there, guide them into that next steps that they need to take. And especially for clinicians out there who are learning about this, this may be something maybe you're prompting. We pray that you would prompt somebody and nudge them in this direction to get the additional training to help people who have been betrayed in this manner and know best how to take care of them. And so, God, we just give this all to you and just trust you to work in the lives of each person here. And whatever golden nugget they might take away from this, I pray that, God, you would take it and just minister to their needs. And we pray this in your name. Amen.
Amen. Well, thank you so much for closing in prayer, Dr. Hinkley, and thank you for being on the podcast today. I really appreciate it.
And you're welcome, and I enjoyed being here.
Well, great. We appreciate it. And thank you, listeners, as well, for joining us today. I hope this is informative and helps you be a better counselor or counselor in training. And we just trust the future of the Lord as far as the way you help people with these kinds of issues. So thanks for joining us today, and we'll look forward to having you joining us next time here on the Mental Healthy Podcast.
Thanks for listening to this episode of Mental Healthy. If you want to hear more episodes, please hit the subscribe button wherever you get your podcasts and head to linktree.com/mentalhealthypodcast for all of our social media platforms with the latest mental healthy content. If you have a story to share that relates to what we discussed in in or any other episode, please contact us at mentalhealthy2020@gmail.com. That's mentalhealthy2020@gmail.com. Thank you, and God bless.